Welcome to Derm Clarity, Poor Decisions and Flake News. I'm Erica Ramos. I've spent over 21 years in healthcare. I'm a dermatology physician associate, doctorate of medical science, the founder of RestoraScalp, and the host of this podcast. I'm here to help you make sense of your skin without the hype. Just a quick note before we dive in. This podcast is for education only. It's not medical advice, and it doesn't replace the care you receive from your own provider. My goal is simple: to help you understand what's happening with your skin, hair, and nails, so you can make informed, confident decisions alongside your care team. If you've ever looked in the mirror and thought, why is my skin doing this? Then you're in the right place, because here's the thing. Dermatology doesn't have to be intimidating, overly technical, or explained in a way that makes you feel like you need a medical degree to just follow along. On Derm Clarity, we break down dermatologic conditions in a way that actually makes sense, so you can stop guessing, ask better questions, and feel confident about your skin and your care. Before we dive in, I want to give you a quick preview of what's coming up, because I'm really excited for this conversation. In this episode, I'm sitting down with Jen Rice to talk about exosomes, what they are, and what patients need to know before they actually jump in. If you've heard of exosomes and thought, but what does it actually mean for my skin? This episode is for you. Today, I'm thrilled to welcome Jen Rice. She's a physician associate with over 20 years of experience in dermatology. Jen has practiced primarily in medical dermatology and over the years has expanded into regenerative medicine, working with the cutting edge therapies like stem cells and exosomes. She brings a thoughtful, evidence-based perspective on the future of the field, and she's here to share her clinical insights. We're going to cover the ethics of regenerative therapies and her vision on how dermatology is evolving. Jen, welcome to the show.
Thank you. Thank you so much for having me. I'm so excited that you have a podcast and a platform to share all of your knowledge and help people get great information in a format that you can listen anywhere.
Yeah, I'm definitely new to it. It's new and exciting and a little bit nerve-wracking to put myself on camera, especially after having a halo procedure a few days ago, which I would generously applied cover up to be on camera today. But hoping that I'm really excited about this talk today, because I don't really know, as a dermatology provider myself, I don't really know a whole lot about exosomes, other than the fact that we use our own platelet-rich plasma for microneedling and for hair regeneration. But other than that, I'm so excited to learn from you today, and hoping that the people who are going to listen to our podcast can also kind of learn how those would help benefit them as well. So I'm just going to leave it to you
Yeah.
and open it up and tell me kind of what you've been doing.
Yay. I love this. I do think that sometimes, there's so much information out there. You see even things that come across, whether it's social media or the news or something you're reading or it's like, what is happening? There's a lot of information. So, I had heard of stem cells, and that those have been around a while. And basically, stem cells are like living builders of our cells, and many people in dermatology have been using stem cells to do things like for hair loss. So they
Uh-huh.
will take some practices. Our practice does this. You draw blood, they spin it down. This is your own blood as a patient, right? And then it's a certain amount of tubes, and you kind of relax while it's spinning down, and then the provider takes like the top part off because it'll separate in a tube, and we're kind of taking the really good parts that I guess you could say it's more like cell liveliness
Uh-huh.
from the top, and then they put that in a syringe and inject it into the scalp for for hair loss. Our practice has been doing that a long time. Does your practice do that too?
Yeah, we definitely do it. I just did it last week a couple of times.
And I know that people, especially hair loss, they're frustrating, and we always like it when there's like one answer for something. Like,
Mhm.
oh, you use this, and it makes that happen. And when a lot of conditions in dermatology are kind of fluid, and then it's like, well, you can use this and this and this and that and this, and then together there's an answer, and
Yeah, I
it's the
actually
solution.
really I love recipes more than anything. I've said this so many times on different platforms. I don't love just one thing for treating my patients. I love for patients to have this little mix of all these things that we're doing. And like you said, no hair loss is the same. I think a lot of hair loss that people think of as hair loss is just telogen effluvium, right? Where you're gonna kind
Mm-hmm.
of get your hair back anyway. But there's all these other kinds. That's why derm's so exciting to be in is there's not just one thing that can affect one area and the hair and the scalp are no different, right?
Yes, yes, and, I think though, like, as a patient, and I know when I've been a patient too of hair loss as well as a provider of that, and it does feel like you want one thing, but it is important to know, and I just if anyone's listening and I hear you, like, I really would like to just do one thing, but multiple things are helpful. And so what's exciting to me about exosomes is that I am the patient that I don't like blood draw. I have to lay down. I get all sweaty. It's kind of a big deal, and so it's like they would say, like I always say, well, I'm a bad patient, but maybe I'm just more of a reactive patient. And so the thought of like part of my treatment plan being something like a blood draw, and then is not really great for me. So this is where I got excited about exosomes because I don't have to have blood. Now you can mix them. So I want to say like, you can mix them. But what exosomes are they're usually made in a regenerative like biotech company. I mean, that's so like a regenerative lab that is a biotech company. They're making, highly concentrated products out of human amniotic fluid with minimal manipulation and very regulatory compliance. So then you're talking like a purity issue. And so this
Yeah.
is then can then be either laid on the skin or mixed if you're in other fields like orthopedics, neurology, because this is overlapping to like sports medicine, dermatology, spine medicine, anywhere where there's inflammation, which is like every field of medicine, you can see these exosomes sort of popping up, and it's based on what's the standard of care and those practices and options that are available. So
Yeah.
exosomes,
I would
though,
say,
like
sorry
it's a
to cut in, but I would say it's like there's so many other different specialties using platelet rich plasma as well. And so like ortho uses it
yeah.
for joint injections, rheum uses it for joint injections. Like so what you're saying is that the exosomes can literally kind of change the experience there where you're not having to have your blood drawn to have those procedures done.
Yes, exactly. And that was exciting to me. And what the exosomes are they're like the communicators between the cells. So they don't have like DNA in them. They just are either carrying like a fat or they're carrying like a protein or they're if you think of them like sort of assisting cells, like we have assistants in every sports team where it's like you don't make the basket but you like assist the person that makes the basket. I kind of think about exosomes like that. They're like the little assistant that makes it all happen and makes the cell look really good.
Mhm.
So I think
They're
it's
telling
really
the
fun.
cell to like heal or to calm down or to act younger, right?
Right, right. What they think a lot of aging is in general, and any chronic condition too could probably go along with this, but it's disrupted cell communication. So it's disrupted signaling that starts to happen. And we know that's what cancer is. A cell decides it's going to do something differently. And then just nobody realizes that, like when I say nobody, I mean the other cells don't realize what's happening. And then that cell has kind of gone rogue. And so exosomes are a way to help modulate these sort of inflammatory pathways that are occurring.
Hmm. And then I know that there's some debate on, the topical use of them and do they penetrate and are they helpful, without assistance, let's say of microneedling or injection. Do you have any thoughts on that as far as needing some sort of access through the skin in order to be helpful?
I know that there's some brands that have come out that are just topical. I think that they have good science and papers and maybe before and after. I know like one brand in particular we have at our practice called Plated. Our doctors had done the research, those that were very interested in a topical product. It's quite it's on the higher end of an investment for a patient. So I think it's important to have good skincare, whether you must have that topical is kind of probably up for debate. And then procedure wise, everything I've read about and learned so far is that most of the time it is micro needling. I did read some things about laser
Hmm.
and then the application, and I know that there are certain practices maybe offering that, but it does help to with microneedling. What you would do is they would put on some numbing. Say this was for microneedling, so like numbing on the face, and then kind of relax and let time go by a little bit, and then they would place the exosome, highly concentrated solution on the face, and then it would act as the medium to run the microneedle across across the face.
Yeah. And the microneedling or even laser, I like to equate it to my patients like we're aerating the lawn, right? We're poking all these little holes in the surface, the skin, just like we do in our yard, or I don't know, maybe people don't do that anymore, but you're poking all these holes in your yard because you want all this green, lush, healthy growth to come back up. And that's the same concept between microneedling and lasering is that we're poking all these holes. And so if you're putting the exosomes on as the medium, like she said, where we're using that to microneedle over, you're pushing those exosomes down into the skin while you're doing the microneedling. Or let's say the holes are present as in a laser, and then we
Mhm.
put the exosomes on afterwards, they should be able to make it down into those tiny little holes that we've just used to penetrate the surface of the skin. So pretty cool stuff.
Yeah, I think it's moving fast. And I that to me is how medicine feels lately, where there's just something new and then something new and then something new. And then some things buzz and don't stick and other things stay around longer. So
Mhm.
it is a great field in that. And I do think as a patient, I like that we're getting more choices.
Yeah. Jen, with the, let's say PRP, we're using our own blood. There's still a cost to the labor of drawing the blood and spinning it down and all of that. And then there's the exosomes without numbers, because every derm practice is going to be a little bit different. What do you think? How would the price of having like your own blood versus using exosomes, do you think it's relatively the same, or do you think that there's a big difference in choosing one over the other?
I think that the exosomes are more expensive, maybe 3 times more, maybe
Hmm.
4 times more, because the product itself is quite expensive. It reminds me of, like, the investment of certain fillers or these long-lasting fillers, so when you have a consumable, as we call them, where, it's made in a lab, and if it's a high quality exosome, it's going to cost the practice, in the 4 digits to have. So then there's also, um, doing the procedure and of course all those consumables around that and times. And I think that the results with exosomes seem to be maybe more powerful because they're going to leave behind these messengers and help the cells that you have than just using your own cells in a different way again.
Yeah, it makes sense. And that I was kind of wondering risk versus reward, right? And so the great thing about the PRP is it's your own body, right? You're using something. So the risk is really low with that. How about risk with exosomes?
It's not derived from another human. The way it's modulated in the lab is like it's built. So although it says amniotic source, that's not actually, it's a little more complicated. The biotech people have it figured out, but basically there's a human source, but it's not carrying any of the risks of like a human blood or
Yeah, I
a
think that's
plasma.
important for
Yeah.
patients to understand is you're not getting injected with somebody else's amniotic
No.
fluid. Right.
No. No.
Mhm.
Right.
Yep.
So I think there's no risk on exosomes topically. With any now these topical skincare lines, I think I would probably try an area first, like we always say, to make there's other ingredients in there.
So,
Yeah.
not always
Yeah.
necessarily the actual medicine that's within it.
Right.
It's the lanolin,
Yeah.
it's whatever, whatever else that's in it that's causing a reaction a lot of times.
Preservatives. Yeah.
Mhm.
Yeah.
Yeah.
Exactly.
Fragrance. Fragrance is a huge one.
Oh, right.
Yeah. So how do you like as far as results, right? So this isn't instant results. This isn't like having a filler injected into your face and having that instant plump, right? So with exosomes or even with using our own PRP or our platelet-rich plasma, we're seeing slow, gradual regenerative results, like you said.
And I do think when they're using it, what I have witnessed in the neurology field and spine field is when they use these injected like in the spine or spinal space, by a neurosurgeon or interventional specialist that the patient has noticed within 48 hours anti-inflammatory benefits. So it's pretty exciting when it comes to this interarticular. I know that's not, laying on the skin, but when we're talking about tendons, ligaments, joints, and
Mhm.
that's
Yeah.
pretty great.
Yeah, incredible things. I'm getting ready to go in and have C-spine surgery myself. So,
Oh.
but I know they're doing the disc replacements. I'm not sure how far down the exosomes have made it into the practice that I'm going to be seeing, but that's very exciting that we're able to use these things to help the body regenerate and rejuvenate itself.
Well, that's how I even learned about this was the neurosurgeon that I met. She had gone to functional neurosurgery and was trying to do less surgery to see if there were ways that she could help people with their spine without
Hmm.
doing surgery and their brains. And then this is where those other modalities and that she had been studying stem cells for the last decade and kind of following people that
Hmm.
were in the know of it. And so I've learned a lot about it from her. And then I have been sitting in with her patients now in Texas and hearing from them what happens when she does an intra-articular injection into the C spine of exosomes versus surgery.
Yeah. So tell me her name again.
Dr.
Okay.
Marcella Madeira. Yeah.
And she's based
And
in Texas.
she was a John Hopkins trained neurosurgeon. She did clinical, regular, allopathic, lots of surgery for 10 years before she went out on her own. And found that when patients were involved in their own healing, so you can have a short term result, right? That's maybe comparable to a surgery. But what's the long term result? Like, are they holding those results or does something creep up again? And if inflammation is at the root of a lot of this, when you stomp that out with something that's non surgical too, you have that lasting benefit. So
Mhm.
she has a spine, one in Austin and one in Fort Worth. She's under drmarcella.com.
Because we're all dealing with all kinds of things other than, maybe searching out a source for dermatology. And so it's really cool when two worlds collide. It's very interesting that you, as a derm PA, ended up kind of colliding with this neurosurgeon who's doing this research in exosomes. How are you planning on kind of integrating that back into your practice?
Yeah, so I have come back with a lot of information for the doctors that I work for and to see if we're a heavy medical dermatology practice. We do a lot of skin cancer. I'm in Naples, Florida, so we have a lot of retirees, and but people are reading a lot, and they come to us about New York Times articles and all the things that they see, and they want the latest information.
Mm-hmm.
And so I have proposed some things that we can begin to do, regenerative medicine wise. But for me personally, I accepted, work with Dr. Marcella, and I'm supporting there virtually as well as traveling there to be a part of treatments. And so I do think it's wide open to see
Mhm.
what the future brings.
Yeah. What initially drew you to regenerative medicine?
Well, I personally had some health issues pop up about 7 years ago, my mid 40s. Really just didn't even think much about, lifestyle. I didn't know what functional medicine was. I was sort of just in the grit and grind of
Me
PA work.
too.
And
My whole feed on social media is now all about perimenopause. I think that's all I read about right now, but
I know, I know. Yeah, so yeah, well, it was my own personal health things, and that's when I found functional medicine as a patient and walked those shoes as a patient. And then I thought, guess I should, if I learned this, it might be helpful to all the patients I see,
yeah. Yeah,
and
it
I can
can't just be
integrate some
me
stuff.
dealing with all this stuff, right? There's other people who are feeling the same way and needing the same answers that I need. So that's a great way to kind of discover something new is when you need it as well.
Yes, yeah. And I love
And
how there's so many opportunities. There's just lots of neat things out there now, and access is unprecedented, right? Like you don't have to physically go into places if you don't have to.
Mhm.
Or if maybe you live somewhere where, I mean, because I do talk to patients all the time that come down here for the winter, and they can sometimes live in really rural areas that don't have
Mhm.
access.
Yep. I have a lot of those patients too that are coming down to Texas. So same thing. We got Texas and Florida staying warm all year, and then all these patients coming down from Alaska and Montana trying to get away and stay warm. So something I aspire
Yeah.
to do when I'm retired as well. Go back, be a back and forth snowbird.
Yeah, cool off in the summer, right?
And then warm up in the winter. And then these patients, though, they do end up sharing dermatologists. So they've got their dermatologist back home, and then they've got their derm practice that they go to when they're in their warmer environment. And it brings an interesting mix into the clinic.
I really appreciate the perspective of also learning from patients that do come from all over the country.
Mhm.
And then with that comes these questions about what about this treatment or what about this
Mhm.
thing? Somebody might hear about it in a big city because even the big cities come down too. They might say, "Hey, I read this thing." And so I think just knowing what's out there and trying to stay aware. I mean, everybody's
Mhm.
practice may not carry it, but aware of what can be the options. One as a patient, right? Because we always want to look out for like what we might be interested in, but also,
Mhm.
what patient, what might be helpful to steer patients towards and who to see.
Yeah, I do have a patient who comes in from LA, flies here to visit family, but then comes into Texas from LA because it's extremely hard to get a dermatology appointment in some of these larger
Yes.
cities. And he comes to me for PRP injections basically all over his face, just regenerative.
Oh
So,
wow. Yeah,
mhm.
that's great.
So we're a member of this community called Biomed SA here in San Antonio, and we did this tour of different manufacturing facilities, mainly because of my other side hustle, which is bringing that dry shampoo to the market and a small pharmaceutical company. So there is a place here in San Antonio that we toured that is manufacturing exosomes. I'm curious, maybe if it's the same spot that she's um, been sourcing stuff from as well.
I love that the access is there. And with the lab, it's actually in North Carolina. It's called Nova Vita Labs, and they're in North Carolina, and they are a physician-founded lab. So they're one
Okay.
of the few, I guess, physician founded labs, which also has, of course, a biotech team with it. And I think that she personally knows them and also just has validated those have been what we've been using with patients.
Yeah. Love it. You
Yeah.
definitely want to trust your source. And that's another big thing in medicine is vetting the things that we're using on our patients to make sure that they're safe. So I just really want to thank you for coming on and being one of my first guests for Derm Clarity. Jen, thank you so much. It's been an amazing experience. We're probably, how many years have you been in Derm now?
A little over 20.
Yeah, so I've been not all in derm, but in medicine for over 20 years, and it's time for us, I don't want to say, dare I say, old ladies. Yeah,
It's okay.
gorgeous
We
exosomes
don't look old,
activities.
so there we
Yes,
go.
to get out here and share our knowledge. And I really thank you for your perspective on regenerative medicine. I really think it's great for patients to kind of get a better understanding of all these things that, they get like 5 minutes of us trying to cram this down their throats when they're in our office, and they need something to look back at and get a little bit more information on. And I think this was a great talk on exosomes. So thank you so much.
Yeah, thank
Um,
you so much for having me.
Thanks so much for spending time with me today on Derm Clarity, Poor Decisions, and Flake News. My goal is simple: to help you understand your skin so that you can make more confident, informed decisions. Because at the end of the day, better skin starts with better understanding. And here on Derm Clarity, we're all about making better, poor decisions without the flake news. When you understand your skin and stop guessing, that's when clarity begins. Because great skin isn't just about what you put on it, it's also about what's happening underneath. Thanks for hanging out with me on Derm Clarity, Poor Decisions, and Flake News. I'll see you next time.